right SI is a little fixated, so we're using the table to help assist us loosen that joint up. Marissa adjusts very, very well. Sometimes me just palpating like that, she's already adjusting a little bit.
Hypermobile, especially right now.
Oh yeah.
Hello everybody, Copstein Chiropractic here. We are going over Webster Technique and how that works with pregnant patients. So Webster is a chiropractic technique that involves a few different pieces that go together that help with pregnant patients in order to make sure that the pelvis is aligned well, helps with low back pain, helps with that pubic symphysis pain. It can also help with like the sacral pain or the pain that can happen down low. So here we're working on the psoas and we're doing a release there, which is part of the Webster Technique, where you look at the alignment based on the tightness in the hips and the tightness that can happen through the backside as well as the round ligament around the front. So student Dr. Kendra here is working on that psoas release, so she's getting more on that internal side. In cases where baby is either moving around a lot or seems to just kind of want to be hanging out in one spot, it can help just stimulate some activity for the baby and for mom in order to help throughout the pregnancy as far as keeping things aligned, keeping them moving well. I always tell people there's no guarantees if the baby's breached, there's no guarantee that we're going to turn the baby, but we always advocate for throughout the pregnancy, especially into that second trimester and forward, to continue with some pretty steady chiropractic care, whether that's once a week, twice a week, to help out with whether we're dealing with pain or whether we're dealing just wanting to get better function and movement for the mom throughout the pregnancy.
One more.
Yeah, and then we always tell people, like, based on how they're feeling, how they're moving with it, that we want them to continue to move as they feel comfortable, whether that's exercise, walking, working, all the above. And then as they get closer to their due date and delivery, they can come in a little bit more frequently if they're feeling like things are a little bit harder to deal with, or if they're feeling like, hey, I just want to make sure my body is prepared and ready to go. But yeah. That was the dad?
That was the dad out
He was
there.
peeking in the door. But I'm going to let Dr. Kendra continue with her examination and her Webster process with our patient here.
Baby's moving.
There's also mapping and things that you'll see Kendra's doing where she's pressing her fingers into the belly and we can actually feel where the head is, where the butt, where some feet are hanging out. So you can kind of get the alignment of where the baby's hanging out.
Really moving.
A lot of times with Webster, you'll get a lot of movement happening where it's just like, woo, excitement. There's freedom to move a little bit more if there is any like tightness happening on one side of the pelvis or the other. But yeah. Kendra, you good?
Thanks, Dr. Andrew. Yeah, thanks, Nicole. Baby always likes when I'm right here, I've noticed.
Right? I think their head is so close to those sides
Yeah.
that they're like, oh, they're definitely very responsive to touch.
Baby's like, who is that?
Right? Can you hear us?
So how has this pregnancy been for you so far?
Well, really good. And I mean, since I started coming twice a week to do all of this alignment and regular adjustments, I was going through discomfort and growing pains. And it really is. I was telling more, I'm like, I feel good. I feel like I can work out harder again.
I love that.
Yeah. There's days that I'm like, okay, I'm held back. But I ran for the first time yesterday in
How'd
a
you
few
feel?
weeks. Great. I felt pretty normal.
Good.
I mean, I ran a mile, you know.
Yeah.
It's about my limit. Then it starts getting just tight.
Yeah.
Like, okay, that's good. Still felt good though.
Yeah, good.
So want to keep it a little, so it's not too long before I do it all again.
Okay. I'm gonna bring it up and then I'm gonna flip. Have you flip onto your belly. No. It's always a mission on finding Dr. Warren in this office. He's flying around everywhere half the
Lots
time.
of different places.
Yeah. All right, Marcia, I'm gonna be on your sacrotuberous ligament, okay?
I know, it's actually, and I'm glad you're doing it today, because I feel like your touch, it's tighter there
Is it?
than it was Monday.
That might be a little tender there. You can just relax. Right SI is a little fixated, so we're using the table to help assist us loosen that joint up. Marissa adjusts very, very well. Sometimes me just palpating like that, she's already adjusting a little bit.
Hypermobile, especially
Yeah.
right now.
Oh yeah. Alright, deep breath in here. Good. All the way up. Good. Good. Little baby crack.
Mm-hmm.
Alright, I'm gonna bring the table up. And for Webster Technique in our office, that's kind of what you can expect if you come in and you're pregnant. And yeah.
Thank you.
You're welcome.